Good afternoon, and thank you for joining us for this briefing on how we're preventing the spread of COVID-19 locally in Lincoln and Lancaster County. Joining me again is interpreter Margie Propp. Thank you so much, Margie, for being here today to provide this important service. And we are wanting to remind all of you who are tuning in to remember to check our website, covid19.lincoln.ne.gov, for the latest information about how you can protect yourself, your loved ones, and our community during this pandemic. Moving on to our situation update for today, we have had 5 people in Lincoln today who've been received confirmed diagnosis of COVID-19, and that brings Lincoln's total number of people with COVID-19 to 97. We want to, again, remind folks that we have an online dashboard that we unveiled this week where you can learn more about the situation and the health department's monitoring of cases. That, again, is at covid19.lincoln.ne.gov. Here to provide more information about the health department's investigations of these cases is Health Director Pat Lopez.
Good afternoon. The 5 new cases today are 2 women and 3 men, ranging in age from their 20s to their 50s. We are investigating and identifying close contacts at this time. 2 Lancaster County residents remain hospitalized, and both are currently on ventilators. Nebraska now has 1,722 cases and 41 deaths. Again, one of those was a death here in our community. Lancaster County's positivity rate remains at 3.8%, and the state is at about 10%, and the national rate is nearly 20%. Locally, we've seen the number of confirmed cases of COVID-19 steadily rise during this pandemic, rather than a sharp increase that would overwhelm our resources and capacity. Again, that has given us more time for surge planning and local health and developing local health hospital capacity. We have daily discussions on those important issues. This open communication has helped our community prepare and to be ready to respond to a potential larger outbreak. Our efforts will also help other smaller communities that don't have the same capacity and resources. To prevent these outbreaks and spikes, the community still needs to understand there is a risk of exposure anytime we are out in a public space where other people are present. We all need to limit interactions with people outside of our own household. We've had several cases in which people who live in the same household as someone with COVID-19 also become infected with the virus. It's also important to know that any prolonged close contact with someone who has COVID-19 puts you at risk. And close prolonged contact is defined as being within 6 feet of someone who is infected for more than 10 minutes. Again, we want people in the community to know that testing is available and we have the capacity to do more. Increased testing is one of the ways we can defeat this virus. Drive-through testing continues to be offered at CHI St. Elizabeth's and Bryan Health. These sites have capacity to do 150 tests a day, and yesterday we completed 112 tests. That's about 75% of our capacity, so we can do more. We're on the right trajectory, but we want to continue to increase the testing in our community. If you have COVID-19 symptoms, a fever, cough, or shortness of breath, you can get tested now. Again, the process starts with a simple risk assessment at chihealth.com or bryanhealth.com. The testing is safe, easy, and fast, with results coming back in about 48 hours. Thank you.
Thank you, Director Lopez. And thanks again to our public for all of the steps and sacrifices that you're taking to help us prevent the spread of COVID-19. We are counting on you to continue to do all you can to help us flatten the curve. And that involves, of course, the physical distancing, the hand washing, the covering your face if you cough or sneeze, and using face coverings when you're out in public. You really are making a difference, and it shows. With so many people who are feeling heightened concern about their health and safety and that of their loved ones, we have chosen to focus this community briefing on wellness and coping with stress during these difficult times. The steps taken and the sacrifices that you're making to prevent the spread of COVID-19 have disrupted lives and normal routines. While we understand the importance of following the latest health guidelines and directives, we do recognize that the changes we're all experiencing have significant physical and mental health impacts on our well-being and on that of our families, our friends, and our entire community. Fear and anxiety about a disease can overwhelm us at times and cause strong emotions to bubble up, both in adults and in children. Cultivating methods to cope with stress is fundamental to our ability to survive and thrive during the midst of this pandemic. Identifying strategies that help us cope and then practicing those strategies makes us, the people we care about, and our community stronger. So we're going to explore some of those strategies today in an effort to survive and thrive together in the face of our shared challenges. There are many things that we can do to support both our individual and our collective well-being here in Lincoln. We have gathered together some suggestions for how to cope successfully and are going to address them in three realms: the realm of the self, the family, and the community. And first we'll start with self. And when it comes to self-care, one of the most important things that you can do is to establish and stick to a routine. Going to sleep and waking up at reasonable times and creating a daily schedule for yourself that is varied and includes time for work, time for family, and time for self-care is so important. I know my husband is teleworking right now and is at home with our 3 kids, and he has created a schedule that he's taped to the fridge. And while I know that schedule is meant ostensibly for our children, it's helping him a lot too. You want to make sure that your schedule includes at least 30 minutes outside each day. Spending time getting fresh air outdoors and in nature can do wonders for personal well-being. We want you to consider focusing on your personal health by eating well, staying hydrated, and moving around for at least 30 minutes per day. Many of our local fitness studios are actually offering free movement classes online. And finally, make time to center yourself in whatever way suits you, whether that's through yoga, meditation, prayer, journaling, listening to music, painting, reading, taking baths, or other practices that help you recharge and find stillness. For me, one important way to find peace and stillness is to have my husband take my cell phone away from me at the end of the day so that I can wind down instead of get more wound up reading about the coronavirus. Which brings us to family. It's so important that we maintain and strengthen our connections with family and loved ones during this time. When it comes to family, there are a number of things you can do to foster connection. Spend some extra time playing with your children. Play can be cathartic and healing for children, and it helps them process the world and problem solve. It's also important to listen to our children and hear how they're doing. Check in with them. Hear what their perspective is. You might be surprised what you learn. Try not to react immediately when your partner or your children display unsettling behavior. It's important to pause before responding and recognize that this situation does not always bring out the best in us, and we each need to show each other some grace during this time. Along those lines, it helps to identify a place where family members can retreat when stressed and to carve out times that are free of social media and COVID-19 discussions. Make time to focus on the good news and the stories of compassion, and maybe even find ways to give back as a family. Finally, keeping connected with the older adults in your life who may be spending time at home alone, like my own mom, who turned 75 today. So I just want to say happy birthday, Mom. And then, of course, there are connections with members of our community. We're all in the same boat right now, and there are multiple groups forming around issues large and small. Consider seeking out a virtual group of fellow homeschoolers or neighbors or bread makers or card players or whatever the case may be. For instance, there's a Facebook group that's been started, and it's called Eating Through the Pandemic, and it offers some relief from the heaviness of the moment by fostering a community of culinary-minded individuals. There's also a lot of evidence that shows serving the community through volunteering and other means can greatly enhance our own well-being. As Gandhi once said, the best way to find yourself is to lose yourself in service to others. Our website, covid19.lincoln.ne.gov, has a page with suggestions on how you can serve the community, including through our new Neighbor Link program, which directly pairs volunteers who are healthy with homebound seniors and persons with disabilities who are seeking support with errands and other medication pickups, as well as connection through phone and video calls, just generally companionship, which is so important during this time. Our children often teach us about the personal value of service and acts of kindness, and you can just ask Sherry. Sherry recently went to her front door and discovered a note written by her young daughter, Berkeley, and it was a note that Berkeley left for the Hy-Vee delivery man. The note read, quote, "Dear worker, thank you for going to work during a life crisis disease outbreak, and thanks for coming to our house at 11 o'clock. I really appreciate you helping me and my family out so we can stay home. It means a lot. Have a great night." Signed, and she didn't put her name, she signed the house liver. That kind act not only made that delivery worker's day, but it also brought purpose and joy to the young house liver. We could all learn from the young house liver. And these are just a few examples of the kinds of things that can help provide stability and nourishment to our lives during this challenging time. I'm delighted to be joined today by someone who has a wealth of knowledge and experience when it comes to wellness and personal resilience. Mary Pfeiffer is a clinical psychologist and acclaimed author who has written extensively on the topics of aging gracefully and navigating complex emotional terrains. Her recent book and New York Times bestseller is titled Women Rowing North, Navigating Life's Currents and Flourishing as We Age. Mary, thank you so much for taking time to share your wisdom and expertise with all of us here in Lincoln today so that we might steer a steady course through today's turbulent times. And with that, Mary, I hand it over to you.
Thank you, Mayor. And by the way, I think you're doing a great job. Congratulations to you. Greetings, fellow citizens. I wish we could be together under different circumstances, but we must deal with what we are given. To quote Albert Camus, we all keep appointments we did not make. Before I offer some suggestions for stress management, I want to make 2 points. One is that stress is cumulative, and the longer the pandemic restrictions go on, the harder it is for us to cope emotionally. We miss our friends and our families that we can't see, and our old lives in the communities. Also, the tedium of invariant routine can grow tiresome. I know from myself that my own cooking is really getting tiresome. Also, not knowing what will happen next is stressful. And in the deepest sense of the word, none of us can really predict anything. We can't make long-term plans or even predict next week for sure. So it's important to sort out what we can and can't control and to focus on what we can control. We don't have much control right now, but we have choices. We can work on being open-hearted and making good decisions about every day, and we can choose to make the best of it. At the same time, we need to show ourselves mercy and allow ourselves to be less than perfect copers. We want to be able to experience all of our emotions without judging, to let our hearts be free, and not to try to micromanage or criticize our own feelings and reactions to the COVID-19 situation. When times are tough, it's important to focus on one day at a time and building a good day. Every morning as you have your first cup of coffee or tea, think through what you can do to create a happy day. From my point of view, a good day includes laughter, pleasurable activities, relationships, and a chance to be useful. Many of us are what the Danish people call skin hungry right now. It's a good time to give hugs and back rubs to the people we can safely touch, and also to enjoy our pets. I appreciate so much my old cat, Glessie, who purrs when I rub her head and jumps onto my stomach when I meditate on the couch. All of us, no matter our circumstances, can be of help to others every day. In fact, our need for a sense of purpose is as vital as our need for oxygen. We can check on our neighbors, play music outdoors for others, make masks, or help distribute food. When I am down, I think of someone who would like a call from me, and I give them a buzz. That perks us both up. Right now, my husband and I are helping homeschool our grandchildren in Canada via Skype, and we're very grateful for the chance for daily contact. Jim's helping Otis learn to read, and I'm teaching Coltrane World War II history by telling him some about his grandparents. I was in the Navy, and my father was in the Navy also in Okinawa and the Philippines. And we're also doing some writing and journaling together about COVID-19. If you need some help, please ask for it. That gives other people a chance to feel useful, and it helps build our community and keep us connected to each other. One other small trick is rating your stress. So if you're having a stressful moment, think on a 1 to 10 scale, if 1 is a broken fingernail and 10 is death, where am I at this moment? And a lot of times that simple little rating will help give you some perspective on the moment. I also think it's important to every day look for 3 things to enjoy and 3 things to be grateful for. Gratitude, by the way, is not some nice, polite activity. It's a survival skill. And the harder the times are, the more we need to muster all the gratitude we can in order to feel good every day. Finally, I suggest we go outdoors. It's spring and the flowers are in bloom, the trees are greening. Watch the sunsets and sunrises, lie down in the grass and watch the clouds. We don't have the Rocky Mountains in Nebraska, but our skies are our Rocky Mountains. Tonight, in the night skies, the Lyrid meteor showers begin around 10 o'clock. You can Google what part of the sky to look in and what the constellations look like around the meteor showers area. So that's one possibility to add excitement tonight. Stay strong, my dear friends. Rise to the occasion. Be kind to each other. Thank you very much.
Thank you so much, Mary. We really appreciate your insight, practical advice, and encouragement, and helping us understand how we can care for ourselves and care for others and find a little more purpose during these days. This crisis, of course, is testing us in more ways than one. Many of us have experienced a greater amount of stress than usual, which has resulted in poor sleep, declining mental and physical well-being, and reliance on unhealthy coping mechanisms. But as Mary pointed out, this does not have to be the case. Even if we make 1% more effort in a couple of different areas in our lives, we can see great improvements in our outlook and personal health. So here's my wellness challenge for you. For the next 14 days, commit to doing at least one thing per day that will advance your own well-being and help you cope with the stress of the pandemic in a healthy way. When you get up in the morning each day, deliberately plan to do at least one thing to enhance your well-being or that of others, whether that's through self-care or through intentionally connecting with your family or the broader community. You will build your own resilience and that of our community in the process. Moving on to an update on some city operations. Our city operations continue to adapt and demonstrate their resilience through this pandemic. This week is National Crime Victims' Rights Week, and we wanted to share with you how the Lincoln Police Department Victim Assistance Unit has adapted the way in which it provides services to victims of crime who walk into the department for assistance. And here to provide more details on these adaptations and measures of resilience is Police Chief Jeff Bliemeister.
Mayor, thank you, and good afternoon. And I thought that this was just a remarkable story of just innovation and continuing to provide the level of service that we have. And so the members of our Victims Assistance Unit are constantly striving, thinking about what ways can we continue to provide the service, the support that is necessary, and keep ourselves safe and those that we're serving safe. And so what they did is they worked with some of the staff within the Lincoln Police Department and the Lancaster County Sheriff's Office, and they created small cubicles within the foyer because the traffic coming into the Hall of Justice has been greatly reduced, just as it has been throughout the community because people are staying home and staying healthy. But when victims of crime who need our assistance come in, they're able to utilize the privacy of these cubicles, and then we use technology, Zoom, to be able to communicate and share screens so our advocates can continue to walk them through the protection order process and some of the most extreme examples, and just resources that still exist within the community that they may have nowhere else to turn. And so I'm just incredibly proud. This was stood up about the beginning part of April of the innovation and just commitment to service by Beth McQueen and her staff. And when I spoke with Beth about this, she relayed how important it is to continue to have this face-to-face without a face covering so they can read the expressions of the advocates and read the expressions of those needing our assistance. And this is one way to accomplish that. So, thank you. The Lincoln Police Department continues to serve in every manner that we can, and we'll do that throughout this pandemic. Mayor?
Thank you, Chief. It was a delight to hear what Beth had to say about the program, and she also wrote, quote, "We believe, like our valued community partners, that this pandemic creates new and difficult challenges for us as professionals, but more importantly for those who are vulnerable to being victimized by others. As it is our duty and passion to continue to serve those members of our community regardless of the challenges we face, we will strive to creatively meet those challenges and continue to serve victims of all crime with compassion, dignity, and hope for the future." So the 2020 theme for National Crime Victims' Rights Week is to seek justice, ensure victims' rights, and inspire hope. And I hope that all residents will join me in thanking Beth and her team at LPD and the Chief for putting that theme into action each day. Moving on to just a few more notes of good news. Today is Earth Day, and the Lincoln Earth Day Coalition is hosting a virtual Earth Day celebration this year, and that will take place this coming Saturday, April 25th. And if you want more information about how to be a part of that celebration, the 50th anniversary of Earth Day, please go to lincolnearthday.org. Again, that's lincolnearthday.org. Now is certainly a good moment to pause and express gratitude for the earth as it's renewing in this season of spring. And we're so fortunate here in Lincoln to have the beautiful outdoors to help us manage through this pandemic. In business news, the University of Nebraska-Lincoln collaborated with the Nebraska Chamber of Commerce and Industry and other organizations across our state to create a business response survey. The purpose of the survey is to gauge the impact of COVID-19 on Nebraska businesses and nonprofits. The results of the survey will help guide local efforts at the federal, state, and local levels to support businesses and nonprofits. And if you own a business or lead a nonprofit, we urge you to participate by taking this survey as soon as possible. The survey is available on the Business Resources tab of our website. That's covid19.lincoln.ne.gov. And the survey closes this Friday. So please make sure you weigh in and have your voice be heard. With that, I open up to questions from the media.
Riley from the Journal-Star with one for the mayor.
Oh, okay. All right.
Hi. Could you talk a little bit about, we had received some questions about the decisions for deciding among city workers who works from home and who still must kind of come in to departments and what factors go into that, as well as maybe restricting who comes in and who doesn't?
Sure. Well, what we've tried to send as a message to the community broadly and consistently is that if you can work from home, please do so. We want as many people to stay home to help prevent the spread of COVID-19 and to help prevent our healthcare system from becoming overburdened. And so when we thought about that from an employer perspective here at the City of Lincoln, our team, of course, talked to every department director and asked them to assess their operations. Who could safely and productively work from home? And we started to work and developed a telecommuting policy that didn't exist prior to this pandemic. And so that was one way that we innovated and adapted as an organization to try to get more folks in a position to commute from home, telecommute from home. That also involved, making some investments in technology that made sense for our organization already, but that got accelerated by this process so that we had, ways for people to zoom into our virtual networks and to be able to do that in a way that was secure. Of course, when you are the city of Lincoln, though, you are providing some incredibly essential, basic city services that can't be performed from home. And whether that's our police force that is showing up for duty and having to patrol our streets and to try to help make sure that there's education and awareness about directed health measures, or our public health officials who are developing and coordinating plans for the entire county in collaboration with system leaders. There, of course, are essential duties and roles, including those folks who are keeping our wastewater treatment plants running. And so we're trying our best to keep our employees healthy. Some departments are doing temperature checks. There are a lot of measures that are being developed rapidly. Our response has had to be as evolving rapidly as the fluid and dynamic situation of this pandemic. So we're continuing to try and improve each day to keep as many employees safe and to try to make sure that we're serving the public. And part of your question was about the public and what we keep open. Again, we've looked at ways to try to provide more services online just for convenience in the times before the pandemic. This has accelerated our process of trying to provide online access to city services so that we can, for the time being, prevent those face-to-face interactions. That said, we are taking appointments at our different service counters. They just have to be arranged in advance. If people can't access technology, if they can't do things online, we will still do our best to serve them, and we just request that they call and make an appointment, whether that's at the building and safety counter, the planning department, or the clerk's office. So we're doing our best to be nimble during this time. Any other questions?
Riley from the Journal Star for Director Lopez.
Okay.
Good afternoon, Riley.
Good afternoon, Pat. Yesterday's 7 cases. What did staff determine was the, how those individuals had contracted the virus? Were they community spread?
Yeah, for the most part, the ones that we've completed the investigation on, but we're still investigating several of those areas. Some were family related also to identified positive cases.
And today's are also under investigation, is that right?
Right. But Riley, we also, one of our cases today is related to a family member who's already been isolating at home.
Thank you. I wanted to also follow up from last week when you had mentioned investigating a case at Smithfield. Were you referring to, I think it was in reference to another media member's question, but were the information you had, says the health department was investigating a potential case at Smithfield and that there would be more information. Could you clarify, that was that dealing with the plant, the farmland plant here in Lincoln, or was that Smithfield operation outside of Lancaster County?
That was the Smithfield plant in Crete. Also, I believe called farmland oftentimes.
But as far as in Lancaster County, sort of meat operation cases that have been reported to the health department?
There haven't been any. And, we frequently get asked about Lincoln poultry. And the Lincoln poultry that's being referenced where there's an outbreak of cases is in Fremont. But we also have to remember that many people that live in our community drive, and many people who live in communities nearby drive in and out of Lincoln. We have people that drive in from Milford, Crete, Beatrice, Omaha. a lot of different areas, but especially the smaller surrounding communities. So we have a lot of individuals who live in Lincoln that drive to Crete to work every day.
And how closely is the health department monitoring the sort of status at the Smithfield plant in Crete?
We're monitoring that very closely. We are in frequent communication with the health department there and the healthcare providers, and working with them to address making more testing available to the workers in the plant and in the community there. Riley, there's going to be testing tomorrow in the area that's scheduled, and there'll also be more testing available in Crete through the Bryan Mobile Center on Friday.
Pat, don't go anywhere.
Okay.
This is Diane. We have a question from Macy at Channel 8. They got a tip that an employee at the Walgreens at 17th and South may have gone into work knowing they were positive. Have you heard anything about that?
No.
Okay, and then we have
And I just want to say, if that were the case, certainly I would expect the business to contact us and talk to us. And we have received contact from them.
Okay, and then this one is for the mayor, from Kellen at KLIN. It's about the deferment of utility payments as mentioned by the League of Municipalities at Governor Ricketts' press conference earlier today.
Okay.
Is that something that that will happen here?
That did happen early in our community, both LES and, of course, here at the City of Lincoln. There were arrangements made to defer utility payments. We don't want anyone to be jeopardized in terms of some of their basic services. So LES has done that, and at the City of Lincoln, we have done that as well. I can get you more information on that from our Lincoln Transportation Utilities Department, but that was something we announced quite early on. For people who are having trouble, taking care of basic needs, there are, of course, a number of social service providers in our community, like Community Action Program and others. The Lincoln COVID-19 Response Fund was set up to provide more resources to our nonprofits so that they can assist in the provision of basic needs and services for folks who are struggling. So again, this is a good time to reach out to some of those organizations, and you can learn more about those resources on our website under the Resident Resources tab, covid19.lincoln.ne.gov. And if you're in a position to give to the Lincoln COVID-19 Response Fund, please consider making a donation today. That's at lcf.org. It's being hosted by the Lincoln Community Foundation. We're partnered with the Community Health Endowment and the United Way, among others, and those grants are being made weekly to try and make sure that we are rapidly addressing some of the most pressing needs of our residents. Another question?
Okay, this is a question for Mayor from Nancy at the Omaha World Herald.
Okay.
You'd like to know if the city has made any decisions on opening pools and what kind of rules would apply to that.
Yeah. Those discussions are happening right now. I can let Director Lopez come and address that question, but those are the kinds of decisions we're having to make because, of course, it has implications for staffing at the Parks and Rec Department and, more importantly, for the health and welfare of the people who use our pools. Matt, did you?
I can say that we have been in discussion with both our Parks Department and other independent pool owners in the community. We're still following what's really actually happening with cases in our community and where that peak is. And we'll come out with some recommendations probably in the next 2 weeks about where we're at.
Thank you. Any other questions? All right, well, so much for tuning in. We'll be back tomorrow at 3:30. Please stay healthy and stay well and stay home.